Good morning and welcome back to GP Video Podcast by Nadia in 2025. Okay, so the topic that I'm going to choose today is called polycystic ovarian syndrome. I'm sure that I've spoken about it a bit in my previous podcasts, but now I'm going to open this topic in detail as well because it is a very, very, very common topic. A very, very, very common syndrome occurring in females of reproductive age. So what is polycystic ovarian or ovary syndrome? Polycystic ovary syndrome is the most common reproductive, metabolic, and endocrine disorder affecting females of reproductive age. So the most common reproductive, endocrine, and metabolic disorder affecting females of reproductive age. So reproductive age is anywhere from menarche to menopause, like starting the menstruation till the end of menstruation. According to an estimate, around 1 in 6 women in Australia suffer from PCOS and 1 in 4 indigenous women suffer from PCOS or polycystic ovary syndrome. Here it also says that PCOS affects 8 to 13% of females of reproductive age. The prevalence appears to be higher in Aboriginal and Torres Strait Islander people, as I said. Consider the possibility of PCOS in females presenting with menstrual disturbance, hirsutism, or premenopausal alopecia. Acne is less strongly associated with PCOS, but PCOS should be considered if hirsutism, alopecia, menstrual disturbance, or obesity are also present. Before confirming a diagnosis of PCOS, exclude other causes of presenting features. Again, PCOS is a diagnosis of exclusion. Now, I've given you a lot of information by just reading the topic from therapeutic guidelines, but now I would like to tell you that there are 3 criteria because PCOS, as I said, is the most common reproductive, metabolic, and endocrine disorder. So of course it will have a lot of features. And because it's a syndrome, it's not a specific disease. Syndrome means a cluster of symptoms. So the female can come to you with 1 symptom, 2 symptoms, 3 symptoms or more. And then you have to exclude all the other causes of those symptoms and then come to the diagnosis of polycystic ovarian syndrome. Now, a diagnosis is made if an adult meets 2 of the 3 following criteria and other causes have been excluded. So now we have 3 things in our mind, out of which the female who is presenting to us in front of us should meet 2 of these criteria, and then also we have excluded the other diagnosis by blood tests, scans, whatever is needed. Then we can come to the diagnosis of polycystic ovarian syndrome. Number 1, menstrual disturbances, including secondary oligomenorrhea or amenorrhea. So usually in PCOS, this one talks about oligomenorrhea or amenorrhea, but in actuality, it can be either menorrhagia or oligomenorrhea or a combination of both. So either the cycles are very short, less than 21 days, or they are more than 35 days. So either you are having shorter cycles, very shorter cycles, or you are having very longer cycles. Then again with the pattern, so this is about the regularity, the days. Then with the pattern of bleeding, it could be, you could just go without, you just could become amenorrheic, no menses, or very little menses, or a lot of menstrual bleeding. So again, regularity and the amount of bleeding. Okay, so but it could be any extreme, less than 21 days, more than 35 days, oligomenorrhea, amenorrhea, or menorrhagia. So number 1 is menstrual disturbance is number 1. Number 2 is clinical or biochemical hyperandrogenism. Means hyperandrogenism means male hormones, testosterone. So clinically, biochemically, how will you prove it? You will do free testosterone levels. Clinically, the symptoms are hirsutism, like facial hair, male type baldness, male pattern baldness on your head or on body patches and stuff. But basically, when we talk about male type baldness, it's Of course, we're talking about the head area. So hirsutism, then what do you call it, male type baldness, and as it said here, premenopausal alopecia, so losing your hair from any part of the head. So all like male androgenistic features. So either the clinical evidence, either you have them clinically, or when we do the blood tests, the testosterone levels are high. Number 2. Number 3 is polycystic appearance of ovaries on ultrasound scan. So this criteria is basically called Rotterdam criteria, and according to this, the ultrasonographer or the radiologist should report that there are 20 or more than 20 antral follicles in the ovaries present, and that would be the criteria for one of the 3 criteria for diagnosing polycystic ovarian syndrome. Now, these antral follicles in the ovaries, how are they counted? Usually the best scan is transvaginal ultrasound scan or internal ultrasound scan. Transabdominal ultrasound scan is usually not that great at detecting, the follicles in the ovaries, or an MRI could be an answer. So either there are 20 or more follicles, or the volume in one of the ovaries, not both ovaries, in one of the ovaries, or the volume of one of the ovaries is more than 10 cc. So we've got 3 criteria. Number 1 is menstrual disturbances. Number 2 is clinical or biochemical features of hyperandrogenism. And number 3 is polycystic appearance of ovaries on ultrasound scan, which is usually the transvaginal or internal ultrasound scan. Additional strong features of PCOS, which are not essential for diagnosis but could be there, but usually are there. Number 1 is obesity. Obesity is number 1, weight gain, obesity. And because of obesity, there is insulin resistance with a tendency to develop type 2 diabetes. And number 3 is subfertility. So either it is secondary subfertility or it is primary subfertility, depending on when the patient really developed polycystic ovarian syndrome. So problems with fertility, obesity, and insulin resistance or type 2 diabetes mellitus. So these are the 3 strong additional features of PCOS. So just now imagine a woman comes in front of you, like I'm talking from the GP point perspective, menstrual disturbances, hirsutism, obesity, type 2 diabetes or insulin resistance on the blood test, and complaining of subfertility. So it makes a perfect picture of PCOS in front of you. We'll talk about it later next time. See you guys.